Hi guys, thanks for coming to my channel, Life is Love, and welcome back. So today this video is going to be an update pretty much from 28 weeks to 33 weeks, and that's what I am now. So I decided to make an update on what's been going on since 28 weeks until 33 weeks, which is now, and I wanted to share with you guys yeah, everything that's been going on. So if you're interested in this video, stay tuned. Okay, so I'm gonna start with at 28 weeks. I had a doctor's appointment at 28 weeks. There's several things that did happen at that appointment. I took a 3-hour glucose test. The first time I took my glucose test, it was a point higher than what they wanted, which they considered normal. So they wanted me to take the 3-hour test just to make sure. So I took the 3-hour test and I did pass it. So all my numbers came back perfect and fine. So that was great. So so I did take a 3-hour test. Also at that appointment, I did get 2 vaccines. I got my flu vaccine and I got the Tdap, which is a tetanus shot. During pregnancy, they do want you to take that shot so the baby can get some of the benefits from that shot as well while they're in you, because they won't be able to get that shot, you know, when they're out. So I did get that at my 28 week appointment too. So that's pretty much all that happened at that appointment. I did talk to my midwife about a few things that I did have on my mind that I kind of wanted, and we were able to talk about some things. One thing that I really wanted to talk about was a water birth in the hospital, and at the hospital that I'm going to have the baby there. And at that hospital, they really don't have water births there or whatever. She was telling me that most of the time the doctors are there and they're not really comfortable with that. So she was telling me that pretty much I wouldn't be able to have a water birth at the hospital. She did tell me that they do have a tub there and I could labor somewhat in the tub, but pretty much giving birth in the tub is a no-go. And of course, if my water has broken when I get there, then they're not gonna let me in the tub either. So pretty much if I wanted to have a water birth, I would have had to have a home birth, or maybe even a birth at a birthing center. So that's one of the things I did talk to her about. And yeah, other than that, that was pretty much all that happened at that doctor's appointment. Okay, so something else that through these weeks I've been doing is going to the chiropractor again. I started going to the chiropractor, I believe, at 29 weeks. I started going twice a week because I was starting to have pelvic pain again, which I've talked about in my my previous pregnancy update videos with my last pregnancy. I talked about me having SPD with this, which is symphysis pubis dysfunction, and that can cause some pelvic pain, and I was really dealing with that pretty bad. It was bothering me really bad, so I did start seeing a chiropractor to help with that. I have been going now for 4 weeks and I have seen a major change. My pelvic bone pain has switched dramatically, because I mean the pain was really bad and now I'm not really having that much pain. I am having back pain and they do work on that too. So just depending, I mean I'm pregnant, so of course I'm going to have those aches and pains, but the pelvic bone pain was the worst pain, and they pretty much have that under control now, so that's a wonderful thing. So I do encourage anybody that's having pain, or just, you know, ready to get ready for labor, should see a chiropractor because they work wonders. So yeah, so that's what was going on with that. Okay, something else that really has been going on with me recently, like especially this week, has been my nose wanting feeling like and acting like it wants to bleed. My last pregnancy, towards the end of my pregnancy, I started noticing nosebleeds or whatever. I really haven't had a full out nosebleed, but I do notice like sometimes my nose like at night feels a little funny, like it hurts to breathe in, like the air is too cold or something. But I did notice like when I go to blow my nose or wipe my nose or whatever, I would see like a little bit of blood. So I am dealing with that. Nothing serious. Like I said, I haven't had a full-on nosebleed or anything, but that is something that I am noticing. And like I said, I had that with my last pregnancy too, so it's pretty normal for that to happen. Okay, so I'm going to talk about a few things with the baby. So baby is doing great. He is moving up a storm. His movements have changed totally from, you know, earlier in my pregnancy to now. Before he used to have like major punches and kicks. Now his movements are very slow and dragged out. A lot of the times I feel like there's an elbow or a knee just dragging across my belly, or something like that, and a lot of times that can be uncomfortable, especially when he like pokes something out like an elbow or something and just leaves it there, or feel like he's doing like this, or I don't know what he's doing in there. but that is something that, you know, he has been doing. His movements have changed. Something else that I noticed is hiccups. Baby does have hiccups. One day I was sitting and I just noticed that he kept doing a movement. Like I kept feeling his head hitting down low like this, and I'm like, what is going on? And then I think about it and I just sit back and feel it, and I'm like, oh, he's having hiccups. And then when I tell you those hiccups last for a long time, but it was so cute that he had hiccups. And so that's something that, you know, he has been doing. So at my last appointment that I had, which was at 31 weeks, we did an ultrasound, and the baby was doing good. He weighs around, at that point he weighed around 3 pounds 10 ounces, and everything was perfect, so that was a great thing. Got to see him. He was very active in there, and everything was great with that, so I was excited about that, to get to see him. Something else I recently did, which was last week, was I went and got a 3D 4D ultrasound, and I'll try to insert some of the pictures in right now, but I got to see his face. He didn't want to cooperate really a lot. She was like, he's at a point where he doesn't have a lot of room or a lot of space to really move around or show his face as much, so we couldn't get really a lot of clear pictures, but we got some. A lot of the times his hands were in his face, or the umbilical cord was just sitting right in front of his face. She kept trying to make me do movements, dances, exercises, all types of stuff to get him to move, but he just was like, nah, I'm okay. So we got a few pictures, but that was an amazing experience. I didn't get to experience that with my other pregnancies, so that was something I really wanted to do with this one, and so it was fun, and it was good to see him in 4D, you know, other than the white and black ultrasound. So that was fun, an amazing experience. But that's pretty much all that I have so far for 28 weeks to 33 weeks. So far I have been feeling really good. I am starting to feel that third trimester aches and pains and tiredness and stuff like that. Of course it's gonna happen, but other than that, I have been feeling really good. So I'm just happy that my pregnancy so far has been very healthy and has been going great, and I'm just so thankful for that. So you guys, I forgot to do a belly shot for 33 weeks, so I'm gonna do that really quick. Okay, here's my belly from the front, which I have on black, so looking a little on the smaller side. Here's my belly from the side. My belly is looking kind of small to me right now. Maybe not, but yeah, it's not small at all. But yeah, that's pretty much it for this pregnancy update. I am going to, since it's getting towards the end, to try to do pregnancy updates every week from here on out until I have baby. So so I'll see you guys next week for week 34. I hope you guys enjoyed this video. If you did, give it a thumbs up, and if you have not subscribed to my channel yet, please subscribe before you leave. And yes, that's it for this video, so I'll see you guys in my next one. Bye.